You take away one thing from this podcast, it's like, I do not want you to just sit and lay on the couch or lay in bed all day. Welcome back, everybody, to episode 14 of the Building Lifelong Athletes podcast. I'm your host, Jordan Rennicke, and thanks so much for stopping by. I really appreciate it. I know you can be listening to anybody, anywhere, and the fact that you're here really means the world to me. And today we're going to talk about low back pain, specifically when you have a back pain flare. So we're going to talk about acute low back pain. We're not talking about chronic low back pain. That's usually a different topic, but we're talking about what happens when you tweak your back today. And what we're going to try to do, I'm trying to give you an evidence-based approach, but obviously everybody you talk to is going to have their own spin on things, right? Everyone thinks what they do is right and what, they've had a good experience with. And so it's going to be a little different, but I'm kind of trying to use guideline-driven and evidence-based care here to see how we treat low back pain flare-ups. And I've seen this with a lot of patients as a physician. I've seen lots and lots of examples of low back pain. And so this is kind of from my experience, but also the evidence, hopefully. And a lot of what I'll be drawing to today comes from specifically guidelines from the Australian Commission in Safety and Quality in Healthcare. Essentially, it's a low back pain clinical care standard. It's a huge, 60-page document on how we should be looking at back pain from a primary care perspective or a healthcare perspective. And so it's a really, really helpful document. We'll kind of work through that and kind of talk about my approach and things I do here and there and just kind of how I approach when someone comes in with an acute low back injury. What do we do from there? All right, first we're gonna start with some epidemiology. And about 1 in 6 people report some sort of low back pain, and it's the most common type of back pain. So low back pain is the most common when compared to, neck or mid back. So low back is the most common. And odds are someone who has low back pain if you don't have it yourself. It's super pervasive. Lots and lots of people have it. Fortunately, it's not that debilitating to most people. But that being said, it's still out there all the time. You see it everywhere you go. And so it's very, very important to be familiar with it, even just as a regular athlete trying to take care of yourself or as a healthcare provider. So it's actually the second most common cause for Australians to seek care from the primary doctor. And so that's a lot. And the reason why we care so much is because it costs a lot of money, in terms of healthcare visits, recovery, all that stuff, and lost time at work. So it's really a big, almost like a global health thing in terms of a population health risk. People are missing work, so we're losing work productivity. People are, going to the doctor, so it's costing us healthcare dollars. So this is something that is pervasive and really, really common. So we want to get on top of that. And about, 1/4 of the people who initially recover will have some sort of episode later within a year. And so it's just not to be a bummer, say, oh man, what the heck, I'm gonna have a recurrence, but just so you can have an understanding of this frame. So, about 1/4 of people who have an injury will have about a setback, another one within the year. That being said, that's still 75% of people who will not, but I want to let you know this is something that can happen and can happen again. And you shouldn't be, super worried about it. You shouldn't be, terrified of this back pain, but I just want to have a realistic expectation that occasionally we get it and then you have another flare. And at the end of the day, though, there's only a small number of people where an acute low back injury becomes a chronic problem. And so we try to avoid that. And we think that, there's a couple ways we can hopefully frame it and approach it so that doesn't happen. But we try to, stop it before it happens, because if you do have chronic back pain, if it becomes a chronic problem for you, it's usually a lot harder to treat. And so we're going to try to avoid that by everything that we do here and talk about to try to avoid having chronic back pain, because that becomes a little bit trickier. First, let's talk about some definitions as well. So low back pain in this document is described as pain between the lower ribs and the buttock creases, but can also have pain in one or both legs. So kind of broad. We think about that whole lower back area. That's the quote unquote low back, but can also have pain into one or both legs. And so usually it's pain that doesn't have a specific diagnosed cause. Some terms we use for it are non-specific or non-specified, mechanical or musculoskeletal back pain. All those terms are kind of interchangeable, saying, hey, in that general back area, that's where we're having this pain. Essentially, we use these terms because we're not exactly sure what it's caused by, and there's kind of things we'll talk about here, but it's really, really hard to pinpoint and say, this is the reason that you're having this back pain. Some people will like you to believe that. And sometimes maybe it is that instance, and that is the case, but a lot of times it's much more complex from that. And so it's hard to say definitively this caused that. And so we kind of use those terms like musculoskeletal, non-specific to say, hey, we've got some back pain. But the good news is it doesn't really matter what the definitive cause is, the way we think about it and treat it is really all the same. So let's say you've hurt your back, right? The question everyone has is how long is this going to take? I like starting with this because it kind of gives people an idea of what recovery is going to look like and, what it's going to look like for them. So most people will rapidly improve within 6 weeks if they present early enough to healthcare setting, or if they have these skills to self-manage on their own. And so I like to say 6 weeks is kind of a general ballpark where, hey, we should be getting better by then. What I am saying is it's not 6 hours, it's not 6 days. I say we give things in the scale of weeks. Usually rehab takes a lot longer than people want. And I mean, myself included. if I tweak something, it's always like, okay, hopefully this gets better in a couple of days. But like really, we have to step back and kind of think about, okay, this is a scale of weeks. When I counsel my patients, I always say, hey, this is not something that's going to get better in days. This is a week thing, just so you have that perspective, because it's such a huge difference. When you go into something, say, hey, I'm gonna be back in 3 days. Boom, boom, baby, let's go. I'm fine. But you think that, and then all of a sudden it's still week 3, and you're like, what the heck? Then you might be worrying about, is this what's going on? Is something wrong with me? Whereas we set expectations that, hey, this can take like up to 6 weeks for even quote unquote normal, acute back pain flare, then it kind of gives us a nice sigh of relief, like, okay, like I'm still within the normal time frame. Kind of what we think about is, the first 2 weeks are usually the initial management and assessment. So either getting in and seeing somebody, or you're doing some self-mitigation strategies, but the first 2 weeks are kind of there. A lot of times if you do see someone early, they'll have you come back in 2 to 6 more weeks to kind of see how things are going. And then, if we're at that 6 week period and we're not having any improvement, then that's when we start thinking about referral. Usually referral will happen in about the 6 to 12 week period if we're not getting where we want to go. Like I said, this is average, so everyone's gonna be different. Some people, it will be 5 days and they're like, oh, cool, I'm back, let's go. Other people, it may take longer. You can still have a normal recovery in 8 weeks, 12 weeks. That can happen. But it's just, when we're not getting there in the 6 to 12, we just start to scratch our head and think, okay, is there something we're missing? Is there additional resources that we can kind of pull in and help with? So just something to think about there. And like I said, you can still have improvement after those 6 weeks, but a lot of times it just takes a little bit slower. And like I said, but the vast majority of people, regardless, are going to have minimal pain and disability 1 year later if they present early. So that's why our biggest thing is we try to get early just so we can learn these strategies, we can get help. And then by, in 1 year from down the line that we're not having this issue. Okay, a super important topic to talk about is like, when should I be worried about my back pain? It's super easy for me on this side of the camera to say like, oh, it's probably nothing. It's probably fine, just because the vast majority of things that I see are fine. But that being said, to you, it's different. You're experiencing this pain. Maybe you've had it before. Maybe you haven't had it before. And it can be debilitating. It can like knock people, off their feet and they go, oh, it's such a bad pain. But, so for them, it's like, seems like the worst thing in the world. Whereas at the end of the day, I see that quite frequently, and I can have the perspective to say, hey, I can reassure you, things look okay. But that being said, I do want to go over some things that we look for to make it, help you decide, is this serious? But first of all, don't panic. Odds are very small that it's something serious. In terms of like 95+% of times, this is something benign. Benign meaning nothing that requires intervention, or super serious. And most of the time it's going to run its normal course. Second of all, this doesn't constitute formal medical advice that I'm giving you, just kind of education on the topic, so that if you have questions, you should be able to reach out, with a better informed perspective. But like I said, if there are any questions, this is not medical advice. Go talk to a medical professional. But I'm just going to kind of run through some concerning features for back pain. So like I said, most of the time we're going to have this back pain we talked about. They're kind of non-specific, quote unquote. But these are things that if you're having these are things we reason like you need to go talk with someone. First things first, if you're having back pain with fevers, and that seems to be the cause of it, and they're kind of correlated, that's definitely something we need to worry about. And we worry about some sort of back infection or generalized infection. We want to get that checked out. If you're on immunosuppression, whether that's chemotherapy or other immunosuppression drugs, back pain can always be different, and weird things can happen, weird infections can happen. So that's something we want to keep an eye on. If you have elevated inflammatory markers like ESR or CRP, if those are elevated, sometimes that can mean some other signs of infection or something else going on. Trauma is something we think about. So if you like fell on your back off of like, you fell off my house onto the, on the cement and on my back and I have pain. Okay, that's a trauma, and that's not something that we just sit on. We gotta get it checked out, go get some x-rays, all that. But trauma is not, we're not talking about trauma today. So, and I want to specify too, trauma does not mean, I was squatting or lunging and I had back pain. That is not trauma. Like I said, that doesn't mean it necessarily nothing bad happened, but trauma is like a forceful hit with it, a fall or a car accident, something like that. Like trauma is like a big deal. Additionally, if you have a history of cancer, we always want to get back pain checked out, just because we always worry about, metastases going from somewhere to the back, and that can be causing the back pain. If you're having weight loss, same thing. We worry about like cancer there. If you're having pain at rest, obviously you might have some pain at rest. That's okay in terms of just sitting there. But if it's like getting worse, or it's like you get no rest, when you're not moving, most of the time, non-specific back pain, when you kind of get off your legs or kind of relax, you feel better. And if that's not happening at all, that's another reason to get checked out. And other things, if your vital signs are abnormal, like your heart rate is through the roof or your blood pressure is low, things like that, we always want to get checked out. If you have abdominal pain, like stomach aches, that's not normal with back pain, we want to get that checked as well. And some other big things we talk about here, if you're having like bilateral leg pain, meaning like going all the way down your legs, you're losing control over your bowel or bladder. So if you have incontinence, either urinary or fecal incontinence, that is never normal. We want to get that checked out, obviously. And then additionally, changes in sensation in like the perineum or your saddle area. So if you think of like a saddle where you sit on a saddle, if you're like losing sensation there, that's something you'd always want to get checked out. And finally, if we're having progressive foot or leg weakness, meaning it's getting worse, our reflexes have changed, we can't walk, all those things, the things that sound scary are the things we should get checked out. At the end of the day, if any of these things you had, we definitely want to go in and get checked out because they could be something, more serious. Things like neurologic conditions, infections, cancer, fractures, all these things that we don't just want to self-manage. We want to have someone to help manage us with that. Additionally, just something worth mentioning is if you're younger than the age of 40, there's a specific type of back pain you look for. It's called inflammatory back pain. So if you're like younger in the 30s-ish area and you have pain that's worse in the morning, it's been going on for about 3 months, so it's insidious, it's not acute onset. Let's say you have maybe morning stiffness that gets better with exercise, maybe better with ibuprofen or NSAIDs. All these things kind of trigger things in our mind and think, hey, this might be something called axial spondyloarthropathies, or ankylosing spondylitis, kind of things like that. So like I said, these are lots of big terms, but like all those things that I described, like those are the, hey, if these are going on, we might want to get checked out. But if like none of those things apply to you, then awesome. Let's keep her moving and we're going to figure out what's going on. Okay, so at the initial injury, what we're talking about here is an acute injury, meaning this isn't something you've had for like months and months and months, and it's kind of gotten worse. So this is like, hey, I had, an event of back pain. First thing first, don't panic. Once again, don't panic. Your body is strong and resilient, and this is just going to be a small speed bump down the road. Like I said, we're talking weeks or months, like you're going to look back and like, oh yeah, I had that thing and I dealt with it. Like we're going to get through this. But I know it feels like the end of the world right now. But like I said, I promise you, for the vast majority of people, in a few weeks, it's just going to be a blip on your radar. And so first things first, like we talked about, we had this injury. Go back to the previous section I just talked about and say, make sure there's nothing serious going on. Like I just talked about, we want to make sure we rule out big, bad, scary stuff. But if there's no red flags, then the first thing we can do is just like let things calm down in that moment. And I say calm down because I can't tell you how many times people try to push through a back tweak. And it's honestly probably never worth it. So we need to pull back, stop with the intensity or stop the aggravating activity altogether so you can live to fight another day. Like I said, anecdotally, I see patients all the time who try to push through and they, it tends to prolong the recovery. So like, we just want to avoid that. Like I said, if you're squatting or you're lunging or whatever, and you feel a tweak and you're like, oh, I'm not sure. It's almost always better to just scale back and live to fight another day. Like I can't tell you how many times I've never met someone who's like, yeah, I tweaked my back and I did 2 more sets. And like, that was perfect. That was great. Usually it's the opposite. Like I tweaked my back and then I did another set and got it worse. So like I said, for our lifelong athletes here, what we're looking for, we want to be good not only today, we want to be healthy next week, the month after, a year after. So that's kind of our time frame here. Obviously, if you're like in a competition or you're prepping for a competition, something that the calculus changes there a little bit. But even then, man, the vast majority of the time, you're going to do much better if you kind of pull back, don't exacerbate injury, and then live to fight another day and get back on training the next day or in a couple of days. So like I said, that's the big thing. Like listen to your body as you age as an athlete. It's super, super important to say, hey, if something doesn't feel right, listen to that, understand that, and then kind of go from there and pull back as needed. In this acute phase, we can also think about things like ibuprofen or acetaminophen for pain if needed. But like I said, hopefully you can use these for a couple of days, nothing too crazy. But really what we want to do is we want to take these medications to kind of help us continue to move. Like I said, the number one takeaway, if you take away one thing from this podcast, is like, I do not want you to just sit and lay on the couch or lay in bed all day. Like I said, we might need to take breaks from what we're doing. We might not be able to do the normal level of activity we're used to, but like just sitting down all day, every day is not ideal. Obviously, if you just had the injury, it's okay to go take a little break and get your, take a load off your legs and kind of calm things down. But like, I do not want like prolonged bed rest or couch rest. It's super important to, try to get up on your feet, move around, do some sort of activity. And sometimes taking ibuprofen or Tylenol can be helpful to get that going. But like I said, I want you to be able to do whatever you can. And if it's just a tweak, you can still move around it as you're able. I always say, try to avoid pain-provoking activities, but like you can do activities that you feel okay with. like if you were squatting and you're like, ooh, that hurts, and it hurts when I squat, but like walking is okay for you. Like, man, you can walk, you can do gentle yoga. There's things we'll talk about here, but I want you to keep moving. That's super, super important. And so after this injury, like we talked about, had the injury, and I want you to keep moving as much as possible. Like, it's super critical. You have to move. The earlier you move also, the better you're going to do long-term. So, and what you're doing may not look like anything you're normally used to doing, like I said, but any movement is still better than sitting around. Some possibility to think about if we're kind of having some back pain and a lot of things are aggravating it, think about like really scaling it back to what's quote unquote easy exercise. So if you're doing some light walking, biking, gentle swimming, or honestly just messing around in the pool, stretching, yoga, or really anything that you can tolerate. Once again, there's no specific exercise that's going to magically fix your back pain. I know there's people you'll see on social media who want to make you believe that there's, specific exercises or stretches or strengthening things that will be beneficial for everybody. But that's just not the case. It doesn't seem like I said, there might be, those things might be helpful for you and it's worth a shot to try them. I don't have any problem with like specific protocols or activities, but I just want to let you know that if you, like I said, if you, let's say you're a runner and all of a sudden they're like, oh, you need to do these strength-based things. And you're like, I hate that, but I want to try a different cardio thing. Like, that's okay. You do what you enjoy. And really, like I say, like anything else, adherence is the number one thing. I just want you to be active. So if it's, a different type of lifting, lighter weights, yoga, stretching, whatever, find something that works for you and feels good for you and is not provoking a ton of pain, and keep going for that. I just want you to just, try to stay physically active, try to meet our physical activity recommendations, get in the aerobic and resistance training if need be. But like I said, we just might need to modify on top of that, understanding that I can't do either the range of motion I want, the length I want, the reps I want, whatever it is. Some movement is better than nothing. So on top of movement, I also want to recommend that we are trying to get good quality sleep, as lack of sleep can have a big impact on pain. So just trying to stay active, sleeping, and still trying to do your daily stuff, activities of daily living, and go to work if at all possible. They've kind of seen that the earlier you get back to work, the better outcomes people have. And so it's not ideal when you're saying, oh, look, I can't work because of this, or I don't want to work. Obviously if you have a physically demanding job, you got to do what you got to do. And if you can't physically do it, then that might, involve you missing some time off of work. But the earlier we get back to work, doing our daily stuff, that's going to be super important. And once you start to improve and you're feeling a little bit better after this back tweak, the key is to gradually increase your activity back to what you've done before. Like I said, expect slower than expected results, but as long as we're moving forward, then it's all good. Like I said, I kind of sit back with that 6-week idea saying, hey, we're going to go up and increase gently from there. Like I said, we're not going to take 2 days off and like, boom, going right back to where we want to be. If we had a big tweak, a significant tweak that took us, out of the game for a little bit, it's going to take time to ramp things back up. And that's probably sound like a broken record for me because I say that all the time, but that's super important, is ramping things up for injury prevention and rehab, or in this case, rehab from a low back pain. And like I mentioned, 6 weeks is kind of that general target. And for most people, that sounds super like super long time. It's a lot longer than expected. And you might be earlier than that. That's fine. But I kind of give this 6 weeks to say, hey, this is like a time frame that's very reasonable. When people are at 2 weeks and they're saying, oh my gosh, I'm still in pain, like what's going on? When you tell them 6 weeks, or you understand as an athlete, you say, hey, 6 weeks is reasonable, then you get reassured saying, okay, like it's not as bad as I thought. Like I still have some time. We're good to go. So just like I said, just thinking about that understanding can take a lot longer. And the key is also trying to maintain a positive attitude. We'll kind of talk about psychological stuff in the next section here, but maintaining a positive attitude will be helpful. And on top of that, when I'm talking about all these things that we're doing in activities, I also try to have active management strategy versus passive. Active means you're doing something yourself, whereas passive means someone else is doing it for you. Common example for this is, active is obviously you're doing exercise, you're doing self-guided yoga, you're doing stretches, you're doing cardiovascular training, resistance training, like that's you putting in the work. Whereas passive is someone doing it for you, whether a physical therapist or a chiropractor is stretching you or adjusting you. Like I said, those tend to rely on someone else. And I don't recommend passive things because at the end of the day, I want to empower you that this is on, you can manage this on your own, and that you have the power to move your body, and that it's safe to move again during this injury recovery. A lot of times when passive stuff, people are, quote unquote, like being guided by someone and they feel comfortable there. But when it's up to them to like remove again, well, they're kind of afraid of doing that. Whereas if you've been moving the whole time, you're continually and constantly showing your body, hey, I can do this. I can move. I'm not fragile. I'm okay with that. So for me, it's all in the active things. I'm not saying no passive things. I know sometimes massage or adjustments or whatever can feel good, and that's fine, but it's not something that we should continually going back to. Like one of my biggest pet peeves is when people are getting therapy, whether it's, dry needling or adjustments. And like I said, they all have their place, but when they just keep coming back week after week after week, say, hey, I need to come back, do this twice a week. Like that's not ideal. That's not long-term what we're looking for. We want to build, the capacity in you and the confidence in you to say, hey, you can take control of this. Like you can move, you can be strong, your body's resilient. And so put it on you to be active. And so that's a really big thing that I always talk about, is trying to get you to do active movements and not passive movements. And so let's say we're going through this recovery process and you feel some flares of pain. What do I do with that? You might be the question. So first of all, I want to let you know that pain exacerbations are completely normal and almost to be expected. You're going to have good days and bad days. I give my analogy to patients all the time that recovery from anything, any sort of injury, is kind of like the stock market. We look for trends. On the stock market, you're going to have good days, you're going to have really bad days, but there's a general trend line, right? And if our trend line is heading in the right direction, that's really all I care about. And it's tough because when you're in it, like you have this understanding, like, oh my gosh, this is a bad day, I'm in so much pain. It's hard for you to step back and say, okay, well, where was I 2 weeks ago? That's why it's sometimes helpful to have someone guide you, because most of us are really bad at long-term thinking. We say, oh gosh, it's not getting better. But if you had someone say, well, actually, remember like 2 weeks ago when we were working and you couldn't do X, Y, and Z, and now you can do that and you just have a little bit of pain. Like, it's, oh yeah, I am getting better. Sometimes it's nice to have someone kind of help guide you and remind you that, hey, like we're actually improving there. So that can be very, very beneficial. It's usually my recommendation is if someone feels like they're stalling out on their own, I would say, hey, get this checked out by someone, just because a lot of times having a different opinion, a third party person, can kind of give some guidance into what's going wrong or how we can adjust it. And so that's usually helpful there. Also, I want to let you know that a pain exacerbation does not mean that there's actually damage being caused from that. I know that's a very common thought from some people, but pain is much, much more complex than that. And so if we're having pain, that doesn't necessarily mean something bad going on. But however, if you develop, way worsening signs or any of the red flag symptoms we talked about, obviously that's something that we need to talk with a professional about. But if you're having kind of some pain exacerbations, that's okay. And pain doesn't necessarily mean that anything structurally bad is happening. Next, I want to talk about the power of the mind for a little bit. Clinicians these days should be using something called a biopsychosocial approach for pain instead of the old biomedical approach. Some people will still be using the biomedical approach, but essentially what the biomedical approach is that pain must be coming from a specific site/pathology or finding on imaging. Obviously there are cases where yes, you have a fracture there, like that's coming from there, that's the pain. Or, you did tear your ACL, like that's where we're having the issue from. Like that, I'm not saying that's completely wrong, but that's why it's a part of it, right? We have that was the biomedical model. Now we have the biopsychosocial model. And so we're kind of incorporating multiple things. I think the reason we moved away from the biomedical model is that we've found out that we were having lots and lots of people would get, MRIs, and we have studies that they get MRIs and they have no pain whatsoever. So it's just a random person getting an MRI, no pain. They have lots of things like quote unquote disc degeneration or quote unquote bulging discs. And so, but they had no pain, right? And so we know that pain is much more complicated than just what we find in imaging. If we had people with no pain and we had these findings that people, other people get who are in pain, then it doesn't necessarily mean that that's causing it. Once again, it's not the only thing that could be contributing to it. But that being said, we can't just definitively say like that has to be the reason. Also, we also find that psychosocial factors also can play into recovery. So like I said, biopsychosocial, there's things socially and psychologically that are affecting recovery. We consider the anatomy, the biology, the psychosocial, all these different things that we're having all kind of comes together to figure out, what's causing this pain and what's making this pain or recovery worse. There's lots of different factors that can be involved with a delayed recovery. One thing we talk about is lack of sleep. Most people, when you don't sleep well, you kind of feel aches and pains, you feel like garbage, so that is one thing socially or, psychosocially that can play into this as well. Additional factors that people talk about and can have influence on how to recover is like the beliefs of pain and or how you perceive that pain and activity, right? Some people think that like, oh, the pain is hurting me or moving is going to be harmful for me. Like those are actually really not great habits to have or thoughts to have because that can actually delay our recovery. Some people feel like they need to have extended rest, like I need a baby. Once again, we find with people with that attitude, they tend to have a longer recovery. Additionally, if you have concurrent issues with like anxiety, depression, or low mood, that can also inhibit recovery, which kind of makes sense. Additionally, also some people who perseverate saying, I need to get this sort of imaging, like X-ray, MRI, I need to be on this medications, whatever, like those can also lead to longer recovery. People who've had back pain before or previously have missed work, that can be an issue. People with actual financial hardship can have a longer recovery, or if you're having troubles at work or lack of social support can all lead to prolonged recovery. So as you can see, lots and lots of things are out of control, but I just want you to recognize that having a support system and being resilient is super helpful not only for life, but how you respond to pain. And so once again, you see all these things that can play into pain. So pain is not just like, hey, what should my X-ray showing? Pain is, maybe what my X-ray is showing or MRI is showing, but also like, how is my sleep? How are my social relationships? How's my work? How is my work-life balance? How's my stress? I mean, there's all these things that contribute. And so if one part of your life is way off base, that can be affecting how you perceive pain and how you recover. So it's just super important to know that it's not as easy as a lot of people make it sound, that like, oh, this mechanical thing went wrong, and so therefore that's why you have pain. It's much more nuanced than that, and we should treat it like that. Okay, so next question maybe is, well, I'm trying to do this, Jordan, I'm trying to manage it, but it's not recovering like I want to. What do I do? Well, if it's been more than 6 weeks, it's definitely worth getting checked by a health professional. Like I said, or maybe benefit from something like more targeted physical therapy or hands-on, or talking with a psychologist potentially. And now when I say talk with a psychologist, I am not saying, hey, it's all in your head, but it's actually been shown that psychological therapy or things like mindfulness or stress reduction may actually be helpful in allowing you to kind of understand the pain better and understand the recovery process better and kind of help you reframe expectations. So like I said, it's in the Australian documents that they said like getting someone into who had high risk factors, like if they had lots of psychosocial risk factors, they try to get them into physical therapy, but then also psychological therapy early as possible because they found they had better outcomes. And so as we're maybe not getting there as fast as we want, the question is, do we need an X-ray or MRI? That's always the $1 million question. The answer is most likely not. However, there are a few caveats. Obviously, if you show any of the red flag symptoms I talked about earlier in the podcast, then you're probably going to qualify for some sort of imaging. But with this, like I said, we always have to understand this should be in conjunction with your healthcare provider so you can kind of interpret the imaging. But most likely you're not going to need imaging. The reason is because most likely it's not going to change a thing. Like I said, like I mentioned before, there's lots of studies showing disc bulges in people, and then they rescan them in a few months and the bulge has regressed. And so they didn't need an intervention. It kind of managed it and kind of healed on its own. Or you'll see disc bulges in people who have no pain whatsoever. And so we're not entirely sure, what to make of that. So normally, unless there are red flags, imaging isn't needed as it's costly. Obviously it costs something to go get an x-ray or specifically an MRI. And then probably not going to add anything to the treatment plan. So you're just like paying for us to say, okay, yeah, we're going to keep doing what we're doing. Most of the time without red flags, I say, let's just keep an eye on it. If it's getting real bad, then we can obviously consider things. But like if I get an MRI and it shows me those quote degenerative changes or, normal age related changes, what I'm going to say is, okay, cool. Like that doesn't change anything that we're going to do. I still want you to stick with the original plan. And so we wasted your time and money. And so usually we start with that. Next question is, do I need any pain meds? Well, like I said, the goal here is if we are taking any sort of medications to help you to become more active rather than just completely stop your pain. That's like the first thing I set expectations wise is like, hey, we just want to take it down a notch so we can be active. I'm also going to try to use the least amount possible and the shortest amount possible. So we've also found that lots of medications don't really work. Things like anticonvulsants, antidepressants aren't good options. And people always talk about opioids and they may have some improvement for like short term, but long term actually might prolong recovery. And so long story short, you're probably going to be fine with just ibuprofen or acetaminophen if you need anything. And if after everything you've tried and there's still no improvement, then we kind of have to step back and probably going to take a multimodal approach to this. Multimodal meaning getting multiple teams involved saying, hey, do we need to talk to physical therapy? Do we need to talk to psychology? Do we need to talk with pain management? Who knows what? I think if it's, we've tried lots of things, it's been 6 to 12 weeks, then it's reasonable to talk with either, like I said, pain management or back specialist. They usually are really good at getting these teams together and kind of a multidisciplinary approach, kind of bring in expertise from different angles to kind of help, give you all the resources that you might need to help erode recovery. I mentioned before a little bit about imaging, when to get imaging. I want to touch on that just a little bit more. Like I said, if there's no concerning symptoms for serious pathology, imaging usually isn't necessary and usually leads to unnecessary concernings and incidental findings. So for me, that's one big thing is incidental findings. You're going to take these images on X-ray, right? And they're going to show some age-related changes, how I call it, like these normal things that you'll see, maybe some loss of height between the vertebrae, kind of normal wear and tear, but it can be kind of scary for people to see that and they kind of catastrophize, like, oh no, this must be causing my pain. When in reality, we've, like I said, seen lots and lots of x-rays with people with no back pain having the same findings. And so it leads to kind of confusion. Also, sometimes I've seen things where they find these things on x-ray, say this must be causing it. They have a surgery and it doesn't fix the pain at all. And so, like I said, it leads to more interventions sometimes. So we have to be judicious with it. Obviously, though, there are times when imaging is indicated. Like I said, it's always indicated when there's alarming features. Obviously, if there's any concern for fracture, you had like a big trauma or fall, usually we get x-rays. But if there's other things that's going on, like if we're concerned for disc compression or spinal cord compression, anything like that, MRI is usually indicated for that. The vast majority of the images that we do, though, we do that and it shows, it doesn't show serious pathology. And like I said, how we frame this is really, really important and it can help change perspective. Big words like disc degeneration, facet joint arthritis, and disc bulges or protrusion are thrown around, but all these are typically kind of a normal part of aging. Like I said, for me, I'd say, hey, we got some normal age-related changes. And many people with no back pain are going to have these same MRI findings. And so we know that the biomedical model here isn't going to fulfill everything. I'm not going to explain all of our pain. And so, because if we did have all these people with, these quote unquote findings, we'd expect all of them to have pain, right? If that's where it's coming from, but we don't see that. And so, like I said, at the end of the day, I like to step back and say, hey, the body has normal age-related changes. This is what we're seeing. It wouldn't change our plans and, it should continue to get better over time. Like I said, patients, it's amazing how you frame things can frame how they're going to recover. And so it's super important for you as an athlete too. If you understand that, just understanding that will be very, very helpful. If you say, hey, I got some, little findings here and there, that's like expected. If you've been a lifelong athlete or someone super active, like you're going to find those things. And it's okay. It doesn't mean it's the end of the world. It doesn't necessarily mean that's where your pain's coming from. It can be helpful at times, but I just want to have you have that framework to say, hey, my images, like my pain and my experience is much more than just the images that I'm having. So like I said, I get an x-ray, I get an MRI, it says XYZ, that's all well and good. But like I said, we have to consider all the other psychosocial things that collaborate and kind of help with pain as well and kind of make us understand pain a lot better. And so that's kind of a long one here. I kind of want to just circle up the wagons here and kind of summarize things here. I know back pain can be debilitating, like I said, but typically it's going to get better on its own. I really want you to understand that pain is complex and that most of the time you don't need imaging and that doesn't change our treatment plan at all. The plan that we talk about for acute low back pain is movement. Like I said, with this, we're going to do things that we can do. We're going to modify our activities as need to. And also what we're going to do on top of that is try to optimize our environmental stressors, with sleep and slowly ramping up activity again. So once again, We want to be moving. We're going to have to modify some of our activity, but we want to optimize our other psychosocial stressors as well, and then slowly bring up our activity to get back to pace. Also, keeping a positive attitude and understanding that you are not fragile and that your body's going to heal, it can be super, super helpful as well. If you have any red flag symptoms like we talked about earlier, or your pain's not getting better over 6 to 12 weeks, then it's probably worth to reach out to somebody. But like I said, the vast majority of the time, this is just going to be a blip on your radar. A couple weeks down the road, you're going to say, okay, yeah, I got that. I recovered from it and I did better. So like I said, I hope this framework was helpful for you to understand that like low back pain, it can be very tricky, but I want to encourage you to say, once again, you are resilient. Your body is strong. You can get through this. And most of the time, it just takes a little bit of time and some effort on your part. So thanks so much for listening. I really appreciate it. If you enjoyed this, it would mean the world to me if you liked, subscribed, commented, or share with a friend. Thanks for watching. Now get off the internet, go be active, enjoy the rest of your day. We'll see you next time.